My grandfather had Parkinson's for over a decade, and I saw the impact that it had on his life and actually us as a family as well. He lost the ability to walk. He couldn't do the things that he wanted to do, and he couldn't even get around the house. I met my co-founder Tom, and his dad had vascular Parkinsonism and had these symptoms where he was basically unable to walk, almost entirely wheelchair bound, and it was an NHS physiotherapist that suggested this cueing therapy and how it could help his dad. And we've got this great video of his dad walking along some coloured lines in the kitchen and seeing the transformation that it made. It struck a chord with me, and I knew I had to be part of that company. We started with the technology back in 2019, and the initial vision was, well, how do we help Nigel walk to the pub with augmented reality glasses?
The Stroll assistive technology is analogous to a self-driving car. It's very much like having a self-driving car hood in front of your eyes. We can understand exactly where you are in the world and the world around you. Given some intent to walk from here, say, to another room, we can give you some real-life digital feedback in the world, giving you directions on where to go.
And so we're taking new technology and combining it with this cueing therapy, and then applying AI and machine learning to hopefully make a wearable digital therapeutics medical device for people with Parkinson's disease that they can wear to walk to the supermarket or anywhere in their daily lives, and it'll automatically assist them as they're walking and prevent symptoms of Parkinson's for gait and balance. So the movements that you and I don't think about, like walking and swallowing, that's what Parkinson's impairs. Now, fortunately, a human brain is amazing, and there's other parts of our brain that can control movement, but you can't just change gears like you can in a car. We have to force the brain to do that. And one of the ways that that happens in everyday life at the moment is when you walk down the street using your human autopilot, but when you walk up a flight of stairs, it's a different part of your brain that's more attentional, goal-directed movement. And so we force that, and so we apply cueing, which is providing either coloured lines on the floor or an audio metronome, some kind of rhythmic, auditory or visual cue, and that helps people to overcome these symptoms and forces their brain to change and use that other neural pathway. And that's why people can go from not being able to walk to being able to walk like they did 4, 5, 10 years ago, is because we're simply bypassing the affected area of the brain and using really cool wearable technology to do that rather than kind of old stagnant mobility aids.
The key technical challenges are very much around leveraging this plethora of information that we get from the headset. We have had to build out a specialist engineering team just to embark upon this project alone.
So we're really fortunate. We were successful with the EIC Accelerator, which was backed by the Horizon Europe Guarantee Scheme in the UK. It took us 2 goes to actually win the funding, but that grant process has actually helped shape us as well as a company and helped us to refine our value proposition and our project in terms of what we wanted to achieve as well. We were fortunate enough to win €2.5 million for our project. It's allowed us to pull in the resources that we needed for machine learning developers, AI, medical device regulation, fund our clinical study in a randomized control trial with enough patients in a fully powered study that we're actually going to be able to cross the chasm from this kind of initial early proof of concept of product to actually a commercial ready product at the end of the project. So it's been game changing for us as a company.
Also, a kind of international element, we have a distributed team, we have a scientific team over in another part of Europe, and being able to enable that collaboration is key.
Specifically for this EIC grant, we're working with Maastricht University in the Netherlands.
They kind of take ownership of the whole clinical evaluation side for us. They generate the protocols, they've got relationships with different clinics. They will apply for ethics, they'll recruit the patients, they know all about movement disorders, they will run the study, and then they will write up the clinical investigation report. So at the end of the project, we'll end up with European compliance. So that means we can sell in any country in Europe, and we can use the same data to apply in the UK as well.
Our solution was very much built around the initial goal from our founder Tom and his dad. Wanted to help him to navigate from his home to the pub safely. As it stands now technologically, we have all the right components in place to actually understand the world around the device and understand the state of the user and marry all this together to allow Tom's dad to safely go and get his pint.